Okay, we're going to call to order again at 8:02 the Prison Board of Inspectors meeting. At this time, we will welcome any public comment or any items we do not have on the agenda. If you'd like to make public comment, feel free to unmute yourself and you can offer it at this time. For anybody who'd like to make any public comment. Okay, just one more check. Anyone here for public comment? Okay. Hearing none, we will accept public comment for the items that we do have on the agenda when they are under consideration and discussion. We're going to look for a motion now to approve the minutes from our last meeting in June. Is there a motion to approve those minutes?
Motion to approve.
Seconded.
Okay, it's been moved by Controller Moser, seconded by Sheriff Samsel. Any further discussion on the minutes? Questions? And we do want to note that Denise had sent out a revised set of minutes, and that was sent out yesterday morning. So we just want to make sure everybody had a chance to review those, and those would be the minutes that that we just moved and seconded for approval. But any final discussion on any of the minutes? Okay, hearing none, all in favor of approving the minutes do so by saying aye. Aye.
Aye. Aye.
Any opposed to approval say nay. Motion is carried. Okay, thank you all. All right, we're going to turn it over to Chris and his team for the monthly reports. Good morning, Warden.
Morning, everyone. Starting off with our returning citizen services report with Center County Mental Health, Amy Miller. A year ago, she's seen virtual 7 people. This year, she actually seen 21 in person. Referred 3 to PSU Psych, as well as 6 to Crossall's Mental Health Group. Dr. Wolf is still doing virtual meetings. He's seen 15 returning citizens this past month. Crossroads is still virtual meetings. Drug and alcohol, they seen 7 male 5 times per month, 1 female 5 times per month. The mental health group, they've seen 5 males 5 times per month and 1 female 5 times per month. Center County Compass program, it's one to replace Pride and Choice. The male groups, they have 19 returning citizens with three peer supports. They are seen 4 times per week, 5 times this past month for 5 weeks. Female group is 6 returning citizens, 1 peer support. They were seen 4 times per week for 5 weeks. Graduation for June was 1 female and 3 males. Work release reentry workers and community reentry workers. Centerpiece has 1, maintenance has 1, grounds has 3, and work release has 1. A year ago, we had 0 in work release. Going into our prison monthly reports with Center County population, this is a snapshot from June 30th, 2021. Our total count that day was 189. Out of the 189, 16 was out of Center County population, 19 females, 97 males. Unsentenced was 74, 13 females, 61 males. County sentence was 36, 4 females, 32 males. State sentence were 6, 2 females, 4 males. Out of the 189, 73 was tentative out of county population. It was a snapshot from the same day of 6/30/2021. 73, 24 females, 49 males. Unsentenced was 36, 15 females, 21 males. County sentence was 32, 7 females, 25 males, and state sentence was 5, 2 females, 3 males. Our daily population for June, as it illustrates, the blue line is Center County, the orange line is out-of-county individuals. We on the 1st, we had 107 for county and 78 for tentative county. By the 30th, we are at 114 for Center County and about 75 out-of-county individuals. Our Center County unsentenced for on the 6/30/2021 snapshot, new charges only. We have 33 males, 2 females, a total of 35. Probation and parole only is 13, males, 8 females, 21 total. Probation parole with new charges were 16 males, 2 females, and 18 total, where it comes out to a total of 62 males, 12 females, a total of 74. We did a charge only. Now, this is not all the charges within the facility, but however, we condensed them down as much as we can. We'll start there with a theft. We have 30 individuals here on some type of theft, burglary, receiving stolen property, and so forth. The DUI is 8. Drug charges is 44. Simple assaults are 16. Aggravated assaults are 5. Corruption of minors are 6. Sexual assaults are 6, and 1 homicide. Continuing with our returning citizen services report with the behavior modification status, we have 7 on tier 0. Tier 1 we have 3, and then we have 17 that are out in general population. Our co-occurring disorder, mental health, and drug addictions. A year ago we had 25 out of 81 intakes. This past year we have 14 out of 77 intakes. Comes out to 18.2% of our population. Only 6 were on or have not refilled medication upon intake. Out of the 14, 11 was from center, 5 females, 6 males. 3 was from out of county, 3 females, 0 males. Suicide watch a year ago was 16. This past June was 16 as well. 11 of those from center, 4 females, 7 males. 5 from out of county, 1 female, 4 males. Out of the 16, 4 was detoxing. Out of the 4, 3 was from center, 3 females, and 1 was from out of county, and that was 1 male. The detox total a year ago was 23, 15 from center, and 8 from other. This past June was 31, 19 females, 12 males. Out of the 31, 23 was from center, 13 females, 10 males. 8 was from out of county, 6 females, and 2 males. Our substance detox by the numbers. We had 12 individuals come in detoxing off heroin and opiates. That's 9 from center, 3 from other out of county. Benzo was 2 from center. Meth were 2, and that was 2 from center. We have 7 for alcohol, 6 from center, 1 from other. Oh my gosh, excuse me there. Suboxone. We actually started this because we've seen a large increase in this in the last couple months, so we figured we were going to start tracking the Subutox or substance. We have three total there, 2 from center, and I'm not sure why there's 3 from others, but there should be 1 from other. 4 from multiple, where there's 2 heroin and benzo, 1 center, 1 other. 1 heroin and alcohol, 1 from center. 1 heroin, benzo, and alcohol was from center. FIMAT, again, we are still pushing Vivitrol injections. We have not had anybody take this or come to the counselors and say they want to start this program yet, but we still put it out. All new commitments come in, we give them pamphlets, we talk to them about it, so we're still trying to push this Vivitrol injections. Going into the prime care report, inpatients, we had 0. COVID-19 test results as of yesterday, symptomatic, negative was 264 and recovering was 75. Asymptomatic testing, which we continually test all of our new commitments that come in upon commitments 3 days in, and then on day 14 we do the testing. So negative we have 462 and we recover is 50. Total seen by physician or the PA a year ago was 65. This past June was 81. Total medical transportation for outside physicians a year ago was 10. This past June was 19. Mental health clinician individuals seen. A year ago she's seen 118. This past June she's seen 168. Psychiatrist 56 a year ago, and she's seen 75 this past June. Mental health patients on psychotropic medications a year ago was 115, was 81.6% of our ADP, that was 141. This year is 117, which is 60.3% of our ADP of 194. Daily average patient diagnosed with mental health, a total of 149 out of 194 ADP. Category C a year ago was 79, which was 61.7% of our population. Category D was 13 with 10.2% of our population. This past June, Category C was 122, 62.9%. Category D was 27, 13.9%. Our mental health stability rating, entire population snapshot of June 30th of 2021. Starting with the stability code A was a total population of 21, 11%. Stability code B is 19, 10% of our population. Stability code C is 122, which is 65% of our population. Stability code D is 27, 14% of our population with a total of 189. There's nobody awaiting placement at this time with our total population of 189 for that day. Mental health stability rating by county, starting with stability code A. Blue is Center County and green is Tennant County. Blue, we have 15 males. We have out of county is 6 males. Stability code B, Center County, we have 14 total with 2 females and 12 males. Out of county is 5 males. Stability code C, Center County is a total of 170, 12 females, 58 males. For out of county, we have a total of 52, 19 females, 33 males. Stability code D, Center County is a total of 10. Should be 8 and 2. And we have out of county 17, stability code of 8 males and 2 females. Inmate grievance report. A total of grievance were 18, 3 was non-grievable, 0 was non-grievable found it, grievable with 15, 2 found it, 0 to the first appeal, second to the 11th, second appeal 0. A year ago we had a total of 40. We have 7 refused. The grievables that were found, it was misplaced returning citizens' property, which was replaced. The items were replaced. Second was the returning citizen improperly charged for a follow-up visit with medical. They were reimbursed for that visit as well. Our central booking, last year, June of 2020, booking was 124. This past June was 181, which was a additional 57 from a year ago. 11 to 7 processed 40, 7 to 3 processed 28, 3 to 11 processed 113. That's it for the report, sir.
Okay, thank you, Warden. Any questions from any prison board members on any of the monthly reports? Any feedback? Okay. Any questions, comments from any members of the public, please?
Commissioner Pipe, I have and so does Connie, sorry.
Oh, that's okay. Well, Janet, we'll start with you and then we can go to Connie.
I wondered if somebody could remind me about the staffing situation for mental health counseling. Wasn't there a grant proposal to hire somebody new? And I have lost track of that.
Yes, we've hired a mental health counselor. She started about a week ago, 2 weeks ago, roughly. She's working with our mental health clinicians with Prime Care as well as our other counselors with Compass. We have a training program coming up in September that she will be running with our mental health clienteles called Decision Points. So that training is actually September 28th, 29th, and 30th. And then after that, she'll be starting classes there. Right now, she's meeting with individuals, talking with them, getting to know our population, as well as working with our mental health clinicians when she meets some of the ones that are on the crisis category, that she's meeting with them, learn a little bit from her as well. So yeah, we're just trying to take care of that one step at a time, not trying to give her too much at one time, but she has a mental health background, so she's actually really hitting the ground running and meeting with individuals, and individuals are meeting with her longer than she expected, but she's really happy about that in that sense, that she's getting to know them, getting to help them out and understanding their situation and trying to find different avenues until we get that class and implement it in September.
Thank you. And her name is?
Miss Fox.
Thank you.
Okay, thank you, Janet. And we'll go over to Connie.
I had a question that I was going to ask later, but because the grievance report brought up about medical reimbursement, I'll ask it now. Does the facility have a copay for residents who seek medical care? And is there a difference between those who have chronic conditions and those who have another situation?
There is a copay right now, and that just is across the board, no matter if it's chronic or not chronic. If they're seeing about a situation and they have follow-ups, the follow-ups is not charged.
And what is that copay?
$5.
Thank you.
Okay, thank you, Connie. Any
I
other
have a
questions?
question.
Yes, please go ahead.
Hi, this is Brian Bortry. I volunteer with Nancy Spooner, the women's chaplain. Warden Shell, can you go back to the slide that shows the charges with the bar chart of what people are in for? Yeah, this is just a simple question as I'm trying to learn more about how things work in the facility. Yeah, this one. I just have a question. If someone is charged for drugs, for example, but there's another crime as well, like assault or theft, what ends up on the chart here? Is it just one single overall, or would they actually be counted more than once if they did more than one thing?
No, we do their first charges. So the first charge they're charged with, if it's a drug, that's their first one. That's what we count as they're being detained on that charge. So yeah, there's individuals that have several charges, but they're usually their first one is what the main one they're in there for. And then when they go through the court process, sometimes some of the other charges get thrown out. But right now, our first charge that they're being sentenced with is what that charge would be. So if it's a drug charge, they'd be there. If it's a DUI, it's there. They would be the first one. So hopefully that helps you.
Yes, helpful. Thank you.
I mean, if we would add all their charges on here, our numbers would never equal out to what they equal. It would show so big of numbers, and it just would be falsifying it. Because at the end of the day, we don't know what they're going to be charged with totally, or be sentenced with, I should say. So we go with their first charges.
Yep, and I see, as expected, the drugs are the highest. That's helpful. Thank you.
No problem, sir.
Thank you for the question, Brian. Thank you. Any other questions, comments on monthly reports? Okay. Hearing none, we will then move into the old business.
Okay, just starting off with our COVID-19 correctional facility operations. We'll continue programming virtual meetings as the list has not changed there. Still doing programming, phone call meetings, and so forth. In person is Compass, Center County Mental Health, probation assessment, home plans, and paperwork is all being done in person. Programs, visiting through the non-contact visiting room, is public defenders, private attorneys, chaplain service, interviews for public defender's office. Videos is doing access church services. In the process of adding is leadership program. I think we're looking at October. And then inside out program for Penn State, we're actually looking at something in September to start that program with Efron. The vaccines, COVID-19 vaccine, on June 22nd, we had our third Boalsburg Apothecary COVID-19 vaccine clinic. 32 returning citizens received their first injection. Our fourth vaccine clinic will be held on July 22nd, 2021. Prime Care, we have Johnson & Johnson available at any given time, as long as the returning citizens let us know. 2 of them received the Johnson & Johnson, and all received an incentive of $25.
Okay, thank you. Thank you for the overview there on the vaccines and the operations. We'll pause there and to see if there's any feedback, questions specifically on the programming during COVID-19, how it's being provided to returning citizens, and then also any questions about the vaccine clinics. We'll start with prison board members. Any questions, comments from prison board members? Okay. Any questions, feedback from any members of the public?
This is Brian. I have a question.
Sure, Brian, please.
So the things that have gone virtual, obviously because of COVID, do you have any feel, Warden, for the timetable for returning everything into in-person? I know there's a lot of factors here, but I'm just curious. Do you know yet at what point you think everything would get back to normal, so to speak, as far as in-person groups?
Right now, we're taking 1 month at a time. We talk with the board as well as we talk with my team here is when we're ready to open things back up. Right now, we're just, with the Delta variant coming right now, the Delta virus, we're just kind of real hesitant on opening things up right now. So we're just still being masked. We're still doing our precautionaries here because of our congregated settings. And right now, we're just taking 1 month at a time.
Yep, that's good. I think that's what a lot of people are doing. It's good to see those positive tests are coming back as 0, so that's good. Thank you. I was just curious your thoughts.
No problem, sir.
Thank you, Brian, again. Any other feedback, questions from members of the public? Okay. Hearing none, before we move into the new business and talk about our 400 level policies, we do want to note that on the agenda we had a reminder, and this is just to remind everybody that our board meeting is going to be changed from Thursday, November 11th to November 18th, and that's because we have Veterans Day that follows on that day. So we just want to note that there. And for our August meeting, we can slide that towards the bottom there under announcements. We just wanted to make sure everybody was aware of that as old business. All right, so we'll go into our new business there, and we've got 400 level policies that either are being reviewed or revised, and we'll turn it back over to the warden.
All right, thank you, sir. Approve all reviewed 400 operational policies as they're listed there, from 402 meals, 403 recreation, 404 mail, 406 count procedures, 407 inmate release, 408 public defender access, 409 inmate clothing, 410 computer processing of inmates, 411 is finger food, 413 is inmate requests and grievances, 414 hazardous materials, 416 inmate razors, 419 interior checks, 420 personal hygiene inmate grooming, and 422 sanitation and maintenance. These are all been reviewed by my team. There's no changes at this time. However, I will note that 413 inmate requests and grievances, we are looking to add to that policy later on. Right now, we're working with GTL about making our grievances and our request slips digital through the tablets. And so we have a better way to track our request slips and our grievances through digital, so they can go on the free side of the tablets and put in an inmate request or a grievance, and then we get electronically. We can respond to that and give it right back to him electronically. So then we have a data collection on that for that response corresponding there. It just eliminates the paperwork. However, they still have the opportunity to do that. But that's coming down the road. We just didn't want to put that in a policy yet until we actually have it implemented, and then how the process changes, then we can rewrite that policy to correlate with that. So just letting the board know that that will be coming back sometime in the next couple months here.
Thank you, Warden. Okay, so we have, what we do now is pause to see if there's any feedback, questions on any of the reviewed 400 level policies. And after that, we will look for a motion. But any questions, feedback from the board? Okay. We take the opportunity to see if there's any questions from members of the public. Okay. We're hearing none. We'd look then for a motion to approve the reviewed 400 level policies as outlined by the warden.
So moved.
Second. Okay. Moved by Commissioner Dersham, seconded by District Attorney Cantorna. Any final questions or comments? Hearing none, all in favor say aye. Aye.
Aye.
Aye. Any opposed, say nay. All right, the motion is carried. The 400 level reviewed policies have been approved. We'll move into the revised 400 levels.
Thank you, sir. We're asking for approval for the revised 400 operation policies. I'll go through the numbers. I'll just read them out right now. 401 is commitment, 415 suicide prevention, 421 is sexual assault allegations, 425 is LGBTIQ. We added that as well in our policy statement. Starting off with a 301 commitment, we added in section B, number 3, valid types of commitment documents include, and then we just have the commitments that we're accepting. Going into the second one, added under section E, new commitments, personnel, property. Starting with number 3, it was an additional, the personal valuables of items will be itemized and be secured, sealed by utilizing the new commitment returning citizens personal property packaging system, and then placed in a valuable storage area. The following instructions of the manual just talks about how we use the new property packaging system, security, using the valuables, and then sealing it onto a cardboard box. The new commitment returning citizen property package is designed to provide a tamper-evident package for the storage of new commitments and returning citizens' personal property. Number 4, the new commitment returning citizens' personal property will be secure, vacuum sealed by utilizing the new commitment returning citizen clothing storage system. The following instructions for proper procedures on the secure vacuum sealing new commitments returning citizens personnel clothing property and so forth is basically we're going to seal their property so it's more evidence tamper proof. We added to section F.3 no more than 2 inch from scanned or copied contracted mail handling provider. No originals mail comes in here, so we scan all their original mails and make sure they have copies of that. Starting off with 415 suicide prevention, basically we made a change in section B, number 5A, with an outside crisis services personnel. This is when an individual is asking to talk with crisis. We just contact the county contact crisis service mobile unit for the purpose situation. The contracted crisis services will make the facility aware of the recommendations for monitoring or refer of the inmates or come out and talk to them in the individual. We changed the blanket. We changed, instead of giving somebody that's on a level 2 suicide a blanket, we're giving them a suicide blanket, just more secure for them at this time. Mental health clinician recommended that, as well as our mental health meetings that we had that recommend giving that suicide blanket and not keeping the standard blanket. 421, sexual assault or sexual harassment. We added in section G, inmate evaluation. 2B, added queer. And then we fixed some grammatical errors. Policy statement, we added Board of Inspectors. They still had prison board there.
Okay, thank you, Warden.
I'm sorry, my computer froze up there, but
Oh, no, I didn't know if you were going to break them up. No worries.
And then I was going to, well, I can. Do you want me to stop there, or you want me to continue, sir?
No, please go ahead.
Okay. For 425, the LGBTI, we added the Q for queer. We changed the inmate to returning citizens. We added the following definitions for treatment for this policy only, and we added queer for this as definitions as well. It's listed there. In section A, commitments, we added section 3 to LGBTIQ returning citizens must be housed with returning citizens who have the same sexual genitals on TSPC status until the LGBTIQ returning citizen is able to meet with the treatment team. The treatment team will meet with the LGBTIQ returning citizens to evaluate the situation, evaluate the status, and conduct the questionnaire, attachment A, for proper housing based on their safety, security needs, housing availability, and gender identity. Continuing on to section B with classification and housing. We've always done this, however, it was never written in the policy, so we added to the policy the treatment, starting with number 5. Or action number 6, treatment team shall meet with all LGBTIQ returning citizens on a regular schedule or on an as-needed basis during the returning citizen's incarceration. Since a returning citizen's classification affects every facet of the normal routine, they are entitled to certain procedures, safeguards prior to both initial and reclassification action. It is essential that decisions are not made corpusely or verbally, but objectively with the given factors of the interview with the returning citizens. And then we went into another section of 5 is number 1 is an automated email will be alerted. This is something that comes from Prime Care Medical. So if an automatic email will be sent when any returning citizen indicates a affirmative response to certain PREA questions during the initial medical intake screening. The alert comes from Prime Care Medical. The following actions will be taken place when an alert is received. So just to summarize everything that's there, basically what it does is our PREA coordinator will be identified through an email of an individual that was maybe in as a predator or a victim. And when that comes across as an email, what will happen is once the shift commander on duty will have that alert as well. They will place that into our book, our PREA book, and then the next day that our PREA coordinator and our mental health clinician, and it'll be our mental health counselor, will meet with the individuals, talk with the individuals, and find out the depth of everything and make sure that we're going to classify them appropriately at that point. They will also review it and go over the returning citizen questionnaire from attachment A. That will also be going through as well, just to help out our classifications on that. If there's no action needed, that information and rationale will be logged by the PREA coordinator into a respective inmate notebook in the offender management system, our OMS. If the questionnaire form is needed, it will be completed by 2 staff members and completed that and placed in the OMS as well. The returning citizens questionnaire must be utilized for anybody, basically transgender, intersex, non-specific, or other LGBTIQ. Anybody that identifies as that, we must use our questionnaire. This 11 to 7 shift commander will review the daily release, ensure that if an alert exists for a released inmate, that alert will be pulled from the binder and sent to the inmate records department for placed in the inmate's personal property or personal file. And that's it. That's the short of it.
Okay, thank you, Warden. And we may want to go through each of these. So if we can, thank you. So let's see if do we have any feedback from members of the Board of Inspectors on the commitment, 301 commitment, or is it 401 commitment?
401.
That's okay. No, that's it. We're good. 401 commitment. Okay. Any members of the public have any feedback, questions on the commitment? Okay. Suicide prevention. Do we have any feedback from members of the Board of Inspectors on the suicide prevention revisions? Okay. Any members of the public on suicide prevention revision?
What is a suicide blanket compared to a regular blanket?
It's a little heavier, thicker. It's unable to be wrapped and tied around your neck as an attempt suicide. So it's a thicker blanket that's unable. I look at it almost like a moving blanket. It's heavier like that you can't tie it up. So,
do I understand correctly that when someone is under suicide watch, they do not have free movement of their hands and arms?
That is not true.
Okay.
Okay. So, any other questions on the suicide prevention changes revisions? Okay, moving into the 421 sexual assault and or sexual harassment. Any questions or feedback on that from members of the Board of Inspectors? Any feedback, questions from members of the public? Okay, all right, then we'll head into the last one, for 425. So starting off with discussions from members of the Board of Inspectors, I'll just to understand the thought behind some of the changes, Warden. For the commitment process, so Section A commitments for Section 3 and 4, in terms of what was that? How would that have read before in terms of how would that have read before the change?
I'll pass that to Melanie.
Okay, sure.
If you see where the red is in Section 3, it used to just be LGBTI without the Q, and it used to say inmate, until the inmate, LGBTI inmate. So Section 3 actually just changed the wording of inmate and LGBTI to be returning citizen LGBTIQ. And number 4, treatment team used to say classification team. LGBTI returning or Q returning citizen was LGBTI inmate. The questionnaire was not attachment A. It existed, but it was not attached. That's all on that page if you want to.
Okay, so just specifically on that point.
Yeah, that's all for commitment there.
Sorry, and if you could just jump back to the previous page there. So we didn't add in is able to meet with treatment team. Was it defined how long it would? Was it defined prior to?
Yes,
okay.
It used to be called the classification team rather than the treatment team. That's why it's in red, because the wording was changed slightly because classification's its own thing. So we made it treatment team just to be clear between policies there. And PREA defines we have 72 hours to classify an individual that comes in with specific issues like transgender or non-binary identity.
Okay. So anybody who falls into that classification is able to request a different location or a different classification, where we're just not limiting that to transgender individuals. It's anybody within that spectrum with the LGBTIQ.
Sorry, we're having issues trying not to talk over each other here. Yeah, actually, any inmate in the entire facility can ask for a reclassification of their status. So PREA just really targets looking at people who are more vulnerable populations, and that's why LGBTIQ gets their own policy, because they were identified as a more vulnerable population. So reclassification exists for everybody.
Okay, but PREA outlines specifically a 72-hour time frame where that must occur.
Yes.
Okay, all right. Okay, thank you. And then last, so those were my questions. I just wanted to understand that a little bit better from the policy 425. Any other prison board members have any questions or feedback on the 425 revisions?
I just wanted to note that I think it's a pretty comprehensive adjustment to this policy, and I appreciate the warden and Melanie and Glenn and the whole team's work on updating and revising that policy.
Thank you.
Thank you, Controller Moser. Any other questions, feedback from the prison board? Okay, hearing none, we'll open up feedback, questions, comments from members of the public for policy revisions for 425.
I have some
Janet. Yeah, Janet, please.
So I think I have 3 questions. It might be 4. I'm not sure. So my first question had to do with how soon the treatment team is required to meet with the person. I didn't see anything in the policy, and then Commissioner Pike said something about PREA saying 72 hours. So Just wondered if there's some clarification there.
It's 72 hours. We so if they come in on the weekend, on a regular basis, they'll be seen first thing Monday morning. If they come in that day, our treatment team's going to see them that day. But by PREA standards, it's 72 hours.
So I'm not real. I mean, please let me know what the answer to this question is. But I understood that part of putting things into policy is that that's the way that staff get access to information. They don't go and read the PREA law. Should 72 hours be put into somewhere in here so that everybody knows that that's true?
We train all of our staff on PREA, on the law of PREA. So everybody's trained on an annual basis with PREA.
Okay. All right. Thank you. And my second question, is there a procedure whereby the individual who is going to be evaluated by the treatment team, or no, I guess it's the next slide, where the PREA alert triggers the prime care signal that then goes to the PREA coordinator, who then reviews the alert. What is there a procedure, which I don't see here, whereby the individual who submitted the alert in the first place gets some notification that that has been received?
It's an email. Everything's getting done by an email, and it's tracked through CORE. Prime Care Medical it has their own. It's like our OMS. It's like our OMS with our returning citizens information. They have their medical files, and it's called CORE EM. So there's a tracking mechanism in CORE for this.
So that person would have to go onto a tablet and look at their medical records to see an email? Is that what you're telling me?
It's not an inmate submitting this. This is a battery of questions that between PREA and other medical standards we're required to ask of people when they're coming in, and it asks about their personal history. It's not an inmate saying, I'm a predator. It's us asking a series of questions about their criminal and personal and social history, and then that's auto-generating an alert for us. So the inmate doesn't put a thing in. It's what we discover as a staff that then alerts other staff, hey, this person may have a predatory history and we need to explore that and see if there's a reason they should be kept away from certain vulnerable populations, or hey, this person may have a personal history of victimization and we need to speak with them and find out, do they need to be kept away from a predatory population? So it's not like the inmate knows they triggered an alert. It's a standard series of questions.
Okay, thank you so much. So I was completely misunderstanding what I'm reading. I have a feeling that what I'm asking is a completely different policy number. And what I'm asking, and what we've heard complaints about in the past from the point of view of the Prison Society, is individuals who submit a PREA complaint and hear nothing. They don't know whether it's been received. They don't know whether it's being acted on. They just don't get any notification back. So I'm assuming that that is not part of policy 425, because now I'm understanding it. But can I get an answer to that question as well, or is that off track?
That would actually be in 421, the sexual harassment or assault allegation policy, because it's an allegation of sexual harassment or assault. And part of the PREA standard requires that there's a meeting with them, both to interview the person and ask what occurred, and then a follow-up to tell them the outcome. And we have documentation of literally every single one of those, because that's part of what we're audited on. So anybody that submits the allegation to begin with should have an initial meeting, which is documented. It's a written statement with either a lieutenant that's trained in investigation specific to PREA, or the PREA coordinator, Director Height, or myself or the warden, actually, if we happen to be here. And then there's a follow-up at the end with usually Director Height or any of the trained individuals. And then each file we have on each PREA complaint has both of those in it. And then every month, the administrative team is required to look at every complaint and make sure that all the steps have been followed. And then every year we have an annual reading, and then every 3 years we're audited. So each complaint gets its own process, initially, at the end of the month, at the end of the year, and then during the audit.
So thank you, and I'm really appreciative of that explanation. I also recognize that all you have to do is say the word PREA and it triggers an enormous amount of paperwork and an enormous amount of staff work and all this other kind of stuff. I I will maybe say for a later discussion, but I just want to put out there that we do consistently receive reports that a PREA allegation has not been followed up on, and that it was declared to be not something worthy of this process. And I'm not exactly sure why that is, and I feel like it's going off track. But so I can save that for a later discussion, but I did want to put that out there.
Well, Janet, I would offer that if that would happen again, immediately reach out to the warden and make that notification, and then they can use that as a opportunity to focus in on that specific pre-allegation. That might be the best way to present that.
Okay, thank you.
Yeah. Okay,
I have one final question, and it has to do with the word objectively. So if I'm understanding this policy correctly, that part of the issue has to do with a transgender person coming in and declaring on the basis of their subjective experience what their gender is. And I totally understand the process. I agree with Mr. Moser that it's a very thorough job, but it feels, I'm not sure about the word objectively, since part of what's involved is considering the person's subjective experience.
We kind of agree. Unfortunately, PREA tells us we have to do it objectively, and then the PREA national standards and the PREA national team point out that there is no objective tool and that facilities are required to develop one. So we don't necessarily disagree. That is, however, what the law says without any of the experts really giving us a particular. So we've taken each of the statutory requirements and the guidelines given by the agency that then is dealing with overseeing this. They have sort of best practices, frequently asked questions, all of those kind of things, and their current frequently asked questions speak to the same thing you're saying, that there is no one tool that's given. Everybody has to develop one, and that's where we rely on like our PREA auditor and other facility relationships and try to come up with best practices.
That's a great answer. Thank you so much. I'm done now. Thank you.
No, thank you, Janet, for this question and feedback. Much appreciated. Any other questions from members of the public on LGBTQ policy 425? Okay. All right, hearing and seeing none, we would then look for a motion to approve the revisions and the revised policies for 401, 415, 421, and 425.
Motion to approve the revised 401, 415, 421, 425 and policy statement.
Is there a second to that motion?
Second.
Okay, thank you, Commissioner. It's been moved by Controller Moser, seconded by Commissioner Dersham. Any final questions on the four policies and policy statement? Okay. Hearing and seeing none, all in favor do so by saying aye. Aye.
Aye.
Aye.
Any opposed, say nay. Okay, the motion is carried. Okay. Thank you again, Warden and Melanie. Appreciate that. We're going to head then into our monthly reports from our partners who have joined us, and we'll start with Carrie Hull. Good morning, Carrie.
Morning. Just a brief update regarding our. Yesterday, we have 4 confirmed drug overdose deaths, and we have 3 pending toxicology results. So we are a little below where we were at last year at this time. That's all I have to report. Is there any questions?
Okay, we are hearing no questions. Thank you, Carrie.
Thank you.
Okay, we're going to then also give the opportunity to the Prison Society, and either got a few members there, so we'll let them decide who will provide some comments.
So I'm going to turn it over to Mark and then Connie.
Good morning, everyone. Before I share the comment, this is not a criticism. This is not meant to be taken in a negative way, so please promise me you're not going to do that. From time to time, we get COs talk to us, other county officials talk to us about certain things that are going on, and they raise concerns. So we advocate for them as well as we advocate for inmates from time to time. The concern we're hearing, there's a great concern from everyone I just listed about being 24 officers short. That's the number I hear. I've not seen that number. I'm just going by what I'm told. Having gone to the Corrections Academy not too long ago, one of the things they talk about from a CO's point of view is the divorce rate for COs is rather high. It's a thankless job most times. It's a job that takes its toll personally on the individual and their spouses and their children. So mandating staff, and I know we have to do it, and I'm not being critical of that, is a detriment not only to the CO being tired, it opens us up for liability because having worked long hours as a police officer, I wasn't my sharpest at the end of 16 hours. So there's a concern for liability's sake, there's a concern for the family's sake, and I have to say there's a concern from the inmate's point of view because I know when I go home upset or tired, I somehow take it out on I don't kick the dog or anything, but I kind of yell at the dog. I'm not as nice to the dog as I should be. And I can't help but think that when a CO's tired and cranky and just at their end, I can't help but think that sometimes inmates may get the short end of the stick when they don't deserve it. So I know it's a problem. I know several business owners that can't find enough employees. I get it. So this is not unique to you guys. But yesterday at our prison society meeting, this issue was discussed and there was a motion, and unanimously we decided to bring the issue to you guys, saying that as a prison society, one who advocates for prisoners, and we're advocating for corrections officers at this point, we're very concerned about the short staff. That said, we commend the warden and his staff and the COs that are there doing it. I mean, they're doing a good job. But we're concerned that the staff is short. So thank you for letting me share.
Okay, thank you, Mark. I'll make some comments, and if Warden, if you would like to as well, that'd be fine. So as you mentioned, Mark, this is not just a correctional facility problem. This is a problem in many industries across the country. So not just here, but the country due to the pandemic and from other economic factors that are at play, in addition to it being a congregate care setting. And of course, it's going to be a challenge to hire individuals in a more dangerous situation rather than a cubicle, having it be where they're in a congregate care setting, especially at a correctional facility. So that's a challenge. We recognize that as a salary board and took action to provide a incentive bonus to individuals, $1,500 over the course of several months, where they would get it after signing on, training, and then at certain benchmarks across a few months, they would get a total of $1,500 to assist with that. In addition, we approved an overtime extension, essentially, to our correctional officers to allow them to receive additional overtime if need be. We're also exceptionally blessed to have a leadership team who is not only talking the talk, but is walking the walk when it comes to the warden and many of the other members who are on the call here, who are, in addition to their jobs as being in administration and leadership, are also stepping up and assisting in the facility like they never have before, in terms of being extraordinarily hands-on and assisting in CO roles, which they've all done in the past, and so this is nothing new to them. But they also have the burden and the need to also run the facility as well, and they're doing it ably. Last point will be the 24. The warden can maybe address that best, but I'd caution to appreciate the fact that we were at close to 300 returning citizens prior to the pandemic. With the pandemic, our own Center County population has decreased dramatically. In addition, the tenant counties that we work with, that population has also decreased as well. So be cautious about that number from the amount that we budgeted versus the amount that we need to get to at the facility. And so I just would caution with that. But we certainly need folks who are we need COs as we always did. We needed it before the pandemic. We certainly need it now. But we'll turn it over to the warden maybe just to talk a little bit about those numbers and again how we're handling it currently.
Yeah, like I said, we're all pitching in, all hands on deck, as I mentioned before. I've been picking up shifts as well as Melanie's been picking up shifts. Glenn's been picking up shifts. Our admin lieutenant's been doing dual duties here. He's off this week, so but for instance, I'll be in tomorrow morning at 3 a.m. and I'll be working until 3 p.m. as an officer. The issue there would be is I'm not going to really be able to attend to my duties as a warden, which I'll probably have to do that on Saturday. So we're all working tirelessly here doing that, but we're also in the second set of it, we're interviewing. Oh my, I can't imagine from January till now how many people we interviewed. Melanie has the numbers a little bit here, so I'm going to let her know how many numbers we've hired, how many still here, and so forth there.
We haven't been keeping track of total interviews. Part of our problem with that is we'll get literally today. I started a tracking system recently. We had 20 applications come in. Of those 20 applications, we'll end up scheduling about 10 interviews, but then 5 of them don't show up in the first place, even after we've scheduled them. Right now, out of 20, I have 3 identified that we're making offers to, and hopefully they will all come. I know just yesterday we were talking, we've submitted 21 names to the salary board for the year, and only 9 of those are still working. So 12 of those either declined the offer afterwards, didn't show up on their first day, worked a week and decided it wasn't for them, any of those many things that come up. So I believe we're 19 positions short at the moment. We have 3 more to submit. That'll take us down to 16. And then the state's about to hire because they just changed over their fiscal year. So we'll see where that comes out in the balance here. So we're in a continuous loop. It's about 20 applications every 2 weeks that we process. So probably about 10 interviews we set up. And then we go from there, as many as we get.
So, I mean, we're doing our best. We just had a July 4th cookout. I made chicken barbecue for them as well as Melanie making desserts. So we're trying to keep morale staff up with a little bit. I know it's not a lot, and I know they're, but we're trying to do the best we can here, and I think the staff understands that as well. There are some staff that just will not pick up any shifts at all. So the staff that you're telling to is probably the staff that's probably are the ones that are picking up the shifts all the time, because there are staff that are continuously picking up because the other staff will not pitch in. We're trying to address that as much as we can. But like I said, it's all hands on deck here. So we're all working together, and I think it's working out well for right now.
I acknowledge all your hard work, and I think you guys are doing a miraculous job. It's just a concern. So, yeah, thank you for all you guys putting in taking shifts and stuff. That's amazing. That shows your commitment to the job. But yeah,
I definitely agree. You guys are doing everything you can. Thank you for all those efforts. It's an important job.
There's nothing to be said for what the facility and Melanie and Chris are doing. I would just invite the salary board to take another look at what might make this job more attractive. And certainly any of us from the Prison Society who visit can say and how much long-term employees need. People who've been there for, the turnover is so devastating to the ability to run a good facility. And when we walk in and we know the CO who's at the desk and that person knows us, it makes all the difference in the world, because we know that there's people who are taking care of business. And so anything that can be done beyond what Chris and Melanie are doing to make this job more attractive, I think that the Prison Society would support that.
Okay, well, Mark, thank you for raising the discussion. Thank you, Janet, for those comments. We will continue to work on this and appreciate, again, the honest feedback. Were there any other topics or any other announcements, messages you'd like to provide for the Prison Society? Anyone?
I have a couple of comments. The Parenting Inside Out program will begin session 5 on July the 17th. I am happy to report that those who are going to be participating will be signing up free will rather than being assigned to the class, which was less than ideal in the last session. And I also want to thank Warden Shell for clarifying for me that out-of-county residents would be given the same opportunities as county residents to both participate in the class, and when in-person visits become possible, they'll be able to also be given consideration for in-person contact visits. So I'll have a report at the end of that session to share with all of you. I also wanted to say that Connecticut has now waived all phone call costs. And I know we had this discussion before about the cost of phone calls, and I understand it's an expense, but I do want to say there is some movement across the country to eliminate the cost of phone calls, because when you can't have an in-person visit, your last opportunity is to have a phone call with your family or a video call, whatever it might be. So I would ask that you might consider waiving those costs. And I do want to follow up to see if there'd been any action on figuring out the cost per day for inmates. That was a question from last month that I had, and I know you probably already sent the letter to the out-of-county counties, but I do think it's an important issue to understand.
Truthfully, we did not have time with picking up shifts and everything else. We have not time. It's not an easy snap of the fingers to figure out the numbers. So, I mean, we'll put on our task and we'll see if we can get it done for next month, but I can't guarantee it just because of our schedules right now.
I understand. It's going to keep coming up on my list.
No, yeah. Thank you, Connie. And yeah, Warden, there was really we did not have an expectation that you'd be finishing that for this meeting. Well, I think as we go through our 2020 budget process, we will probably be including that, Connie, to get a better understanding of that. Again, we've had studies done before, and again, it would be a good thing to appreciate, and we can ballpark it right now. But as Warden said, there are other things that he's focused on and need to be focused on. But we appreciate if you'd like to bring it up, you're certainly welcome to. But I think through the 2020,
I'll wait a couple of months before I bring it up again. And the last thing, I just wanted to know whether the salary incentive has made a difference in terms of the people who are applying.
I think we're saying, we're getting more applications in. It's just if they're willing to take the position or not, or if they're going to be able to pass their drug test or their background check is the big question right now. But we are getting, as Melanie mentioned, 20 applications every 2 weeks. So that is an increase than what we've had before. It's just going through all the processes and make sure they can be the ideal correctional officers that we need.
Thanks.
Thank you, Connie. Okay. All right. Thank you, everybody from the Prison Society for the reports and comments. We're going to be turning it over now to Kathy. Good morning, Kathy.
Good morning. I'll keep it very brief since we're running over. Just a quick thank you to the correctional facility. We've gotten multiple conferences now under our belt for Center County Community Conferencing for reentry, and they have been wonderful to work with on that. And we do think that it's going to be a very successful entity of the program. Also, thank you to the correctional facility. We have been able to provide some transportation to returning citizens that I know of that were released but needed rides. One to Butler County to the VA hospital, one to Tyrone. We're happy to do that. And we've got a lot going on here, but I'm not going to take the time since we're over. So thank you.
So Kathy, we're not over. There's no there's no limit to. I mean, obviously, 3 hours maybe.
I understand.
But no, there's no. You can take it. Please don't. No, the time is yours. Please.
Well, I appreciate that. We've got a lot going on. There's
please.
Support groups and leadership groups and all this other stuff. Really nothing. What the warden is experiencing and what they're experiencing as far as hiring, and I believe, Michael, you said that everybody's experiencing that. It's just a little more critical when you get into needs such as what the correctional facility has. People just don't show up for interviews. I'm amazed that people don't want to work. Their long-term career plan is unemployment right now, which is really kind of scary. So, but anyways, I'm not going to take any more time. But I do appreciate the opportunity, Commissioner Pipe.
Sure. Thank you, Kathy. Okay. All right. So we're at the end of our reports then. We do want to note that we will be, for the time being, we're looking at doing another virtual meeting in August, and that'll be on the 12th at 8 a.m. Before we adjourn, is there any other announcements or updates we want to provide? Okay. We're seeing none. We'd look for a motion then to adjourn at 9:09.
Motion to adjourn.
Is there a second to that motion? I will second it. I'm able to second it. All right, it's been moved by Controller Moser, seconded by myself. We will look for a vote to adjourn. All those in favor say aye. Aye.
Aye.
Aye.
We are adjourned. Thank you all and have a great day.
Thank you, everyone.